Hi, good morning. It's a good afternoon. Sorry, in Mexico it's 7 p.m. a.m. It's such a pleasure for me to talk about my country and the necessities of more psychiatrists to full mental health needs. So I'm going to talk about a physician specializing in psychiatry of Mexico. This is an update of 2018. Worldwide, there's a major health challenge such as overweight, diabetes, obesity, and other non-communicable diseases. Mexico is not an exception. At the same time, also the comorbidity, physical and mental health comorbidity, it's increasing a lot of here in Mexico, and since also it's important because it can decrease the risk of suffering and complicate the clinical evolution of communicable and non-communicable diseases. A well-studied example is the presence of comorbidity disorder between depressive disorder with other non-communicable disorders like diabetes or hypertension. And it is important because this comorbidity can increase early disability and mortality. In the event of comorbidity with infection diseases, the consequences will be not compliance with the therapeutic regimen, and also can lead to microbial resistance to existing medications. So the negative impact of depressive comorbidity on the quality of life and various functional aspects of people with physical diseases is also related to an increase in health service and is associated also with a cost of treatments. For example, in the case of radiotherapy, chemotherapy, or antiviral combination for HIV treatment, failure to consider depressive comorbidity may lead to significant economic losses and negative clinical results. In order to provide a more detailed regional vision of the mental health status of countries and territories affiliated to Pan American Health Organization, the World Health Organization and the Mental Health Atlas was drawn up in 2021. Since then, there were 3 updates. The last one is 2014. And among other data, these reports provides to update information on the data, on the availability of data of mental health resources and services worldwide. According to the 2014 Mental Health Atlas, the world average is 21.1 mental health workers per 100 inhabitants in the geographical areas evaluated, included not only psychiatrists, they include psychologists, nurses, social workers, and occupational therapists. So there are a significant difference between regions because there are some regions that are non-Latin American with 69.2 professionals. And we, here in Mexico, according to those atlas, we have only 8.7 professionals per 100 inhabitants. Especially the average rate of psychiatrists of America's region was 2 for every 500 inhabitants. As for the rate of psychiatrists in Mexico, there are, on the one hand, the figures reported by World Health Organization, which probably reflect data on psychiatrists who were not mainly affiliated to public sectors. So Heinze et al. Expand their knowledge about the number of psychiatrists in both the public and the private sectors. They add findings about those information, and they say that there are only 19 0.31% of the psychiatrists had a valid certification in 2016, and 60.34% of all psychiatrists are concerned in 3 states: principal Mexico City, Jalisco, and Nuevo León. There are 3 cities in Mexico. However, this publication does not mention the update on the number of child and adolescent psychiatrist specialists, which amount of 225 in 2011. These studies make it possible to create a current overview of the country and propose incremental measures to training professionals in psychiatry. They also underline the need for the continuous updating and of census of specialists in conjunction with population increase in order to determine whether they comply with the requirements established by the international organization. So this study proposed to update the national longitudinal perspective for the total number of child and adolescent psychiatrists, and also psychiatrists in Mexico, and also to know how many of them are board by the Mexican Consilium board. So we make a descriptive comparative longitudinal study with the following resources. We use the General Director of Professions about the Secret of Public Education, Mexican Psychiatry Association, Mexican Child and Adolescent Psychiatry Association, and all the hospitals that have psychiatric service in Mexico that have the psychiatry or child and adolescent psychiatry specialization, and also private organization offering treatment for mental illness, and about the Instituto Nacional de Estadística, that is about to know the number of inhabitants we have in the different states in Mexico. And the procedure was, once the study was approved by ethical commissions and National University of Mexico, we following data obtained from the aforementioned resources with name, gender, and localization of specialists in child and adolescent psychiatry and also in psychiatry. To the fact that that those records, because in Mexico we have psychiatrists that works on both institutions, in private and public institutions, we have to search if we are not talking about the same person, and that counts double in our sense. So we eliminate duplicate information in the records to create and update, revises, correct and accurate database of each of the specialists distributed by state. In order to determine the rate of psychiatrists and pediatricians for every 100 inhabitants, both nationally and by data from the INEGI and CONAPO that have the numbers about how many people we have in Mexico and in the different states. So that's why calculate the rate of psychiatrists in different countries. So the rates of psychiatrists and child and adolescent psychiatrists were calculated at the national and federal level, comparing it with the average obtained in other countries, and also according to the classification established by the World Health Organization, which divides countries into 4 groups: high income, medium high income, medium low income, and low income countries. Lastly, the number of psychiatrists and child and adolescent psychiatrists were reported, as I will tell you now. So the results we found that there are in Mexico a total of 4,634 physicians specializing in psychiatry on up to May 2018. 30, and we have 365 of whom are specialized also in child and adolescent psychiatry. This is important because we don't have a, if you want to be a child and adolescent psychiatry in Mexico, you have to first study medicine, medical doctor, then you do the specialization in psychiatry, and then you do a sub-specialization on child and adolescent psychiatry. That's why some, that 365 of child and adolescent psychiatry are also in the sense of the 4,634 physicians. Certification and membership of Medical Association of the Specialty at this border council, because we also have to do a board exam. Only 53.9% of total psychiatrists are on make the board exam about general psychiatry, but less than 21% of child and adolescent psychiatry do they have the board certification. That's something worry here in Mexico, that even we have few child and adolescent psychiatry, we also have few that are truly certificate by board exam. So it's important to give to have more child and adolescent psychiatry with board certification. It is important to know that there is a difference between the study that was made on 2012 and then 2006 about the number of psychiatry. We can see that it is increased in the number of psychiatrists that have board certification over the years, but the number of psychiatrists increased just a little every year. So it's important to have more psychiatrists in Mexico, because when we calculate the rate per 100 inhabitants, we can see that the rate of psychiatrists in Mexico is 3.71 psychiatrists per 100 inhabitants. So it's as we can see, it is inferior than a World Health Organization says that we need to have at least 5 psychiatrists per 100 inhabitants. So it's under that number. And also this is Mexico, and we can see their different rates of child and adolescent psychiatry. It's the one that have to here, and in the and about the psychiatrists, and we can see the same thing that we commented at the beginning of this conference, that we have more psychiatrists in Mexico City. We have 22 per 100 inhabitants. That it's a contrast between another city of Mexico, for example, Tlaxcala, that also have not one psychiatry per 100 inhabitants. They have 0.53. So it's a really important contrast. Here in Mexico, we have the child and adolescent psychiatry and also psychiatry are concentrated practically in 3 cities in Mexico. So what is important to remark here, it's important that since the publication of the first article about this database of psychiatrists in Mexico, there are only a 21 increase in the last 6 years, increase the total number of psychiatry, because we're from 3,823 to 634. So we have also a 60% increase in the total number of child and adolescent psychiatry. The rate of psychiatrists in Mexico is a 9.11% increase during the last period. So if we, at this rate of growth, it will take several years for Mexico to report similar rates to other countries, for example, France, USA, no? The number of mental care specialists is insufficient, so and also even if also this not even consider under, because we have also heterogeneous distribution of specialists. As I told you, that we have more psychiatrists in only three countries in Mexico. So it is important that we have to promote more doctors to specialize in psychiatry. That's why we are making a lot of studies about the reasons to study psychiatry and to dedicate to this profession. We also have a program about for the primary care to give them some tools to detect principal psychiatric disorders, so like depression, anxiety, and neurodevelopmental disorders, to increase human resources attaining mental health. Because we have a lot of problems in mental health, as we know, as other countries, but the more important in Mexico also is the violence, domestic violence, and child and adolescent violence. Also suicide is an important cause of death in Mexico, and it's also increasing year by year. Also during COVID-19, it is important to take account that we have increased mental health disorders in Mexico, and also violence increased, not only about narco traffic, also domestic violence is the most important during COVID-19. And there are enormous inequalities in mental health care at international level. So it is important that in Mexico, the amounts of, to an average of 58 per capita, it's dollars per capita for mental health. So we have to increase because in Mexico, the budget in 2016 was the equivalent of 22% of the Secretaría de Salud. Because, and it is important because we don't spend a lot of money in mental health, even though it is important, and we have an increased deaths about this and in young population. And finally, it is important that we have to work in these principal things that I put here in the summaries here, to modernize also psychiatric care service, because it's important that in Mexico we still have psychiatric hospitals, and we don't have made much of integrate psychiatry with other medical or general medicine, with the stigma that those have. We have to formalize the specialist psychiatric care network to make it more efficient, to take prevention and education actions for priority mental health, and to promote training researchers about how when they decide to specialize in psychiatry. And we have to encourage mental health research and the development of community care models with primary care specialists. Thank you so much for your attention. And this is another kind of picture about my country, and it was such a pleasure to talk with you.